Come in.
Good evening, my name is Thomas Anderson. I'm here to interview for the nursing position.
Hi, nice to meet you. I'm Andrea Schultz. I'm the nursing manager, so I oversee staffing for this floor. Go ahead and have a seat.
Thank you.
It's still nice outside.
To me it is. I spent the last week in Dallas, so it's pretty cold, snowing twice there.
Oh, they did get like nasty weather there, didn't they? This is going to be a pretty laid-back interview. I'm going to ask you a couple questions, and then after we're done with that, I'll let you go ahead and ask any questions that you have, okay?
Yes, ma'am.
Alrighty. Can you tell me a little bit about yourself?
Yes, ma'am. I'm 30 years old. I have two beautiful daughters, ages 4 and 6. I've spent the last 11 and a half years in the military. I'm currently a sergeant in charge of 5 medics under me.
Okay.
I'm just recently divorced, and I'm currently a student at Columbus State University.
Okay. Are you thinking about getting out of the Army, or what's your plan with working with us?
Yes, I'll be getting out of the Army in May. Everybody in the Army has an expiration date, and because of my recent divorce and my children moving to Dallas, I feel like getting out of the Army and getting a steady career where I can choose where I live is the best bet for me right now.
Okay. Alrighty. Tell me a little bit about your education level with being in the Army and all that stuff.
So I graduated high school with honors, and I have spent the last 11 and a half years doing various trauma courses. I am a nationally registered emergency medical technician. I've been through leadership classes through the Army, and I currently have 74 credit hours towards my RN degree.
Okay. What are you thinking about this job?
Well, this being an orthopedic med-surg floor, I believe that my background in the Army and being a combat medic, seeing soldiers on the battlefield who were wounded, lost limbs, that I'm very compassionate towards them, and I feel like I can provide the best care for your patients.
Okay. What all encompasses your work experience? What areas you have?
So, as a medic in the Army, we tend to be have to be flexible. I've worked everywhere from kicking doors in Iraq, being the first line medic to take care of people, to working in pediatrics, labor and delivery, and also I'm currently the team leader at Martin Army's emergency room.
Okay. All right. Great. Do you have any questions for me today?
Yes, ma'am. I have a couple of questions I wrote out for you. So, what are the hours like here on the floor?
Okay. We work 12-hour shifts, so if you're on day shift, you're going to work 7 a.m. to 7 p.m., and if you're on night shift, it'll be 7 p.m. to 7 a.m.
Is there any room for promotion or leadership positions if I stay here for a long time?
There is. A lot of times we recommend you to be working on the floor for around like the first year, just so you can use your clinical skills and all the knowledge you've gained from school, and then we kind of further advance you in different areas that you're looking at.
What is the nurse to patient ratio here on your floor?
Nurse to patient ratio, okay. So you're going to have an RN, an LPN, and a medical assistant on your care team, and you will work as a team to care for 6 to 8 patients depending on our load.
Okay, that's all I have.
Okay. All right. Anything else you wish to say?
I just want to let you know that I'll be the best candidate for this position. I'm sure you have a lot of people that have interviewed, but given my background, my leadership abilities, I've worked with so many different soldiers from all walks of life. You learn to adapt. I can pretty much get along with anyone. I've been in charge of soldiers who were 45 years old when I was 20 years old. So I've gotten to be able to be really flexible and deal with everybody. And my compassion level, I've dedicated my last 11 years of my life to taking care of people, risked my own life to do it. So I believe that you won't find somebody as dedicated as I am.
Okay. All right. I think this interview went really well. I'm just going to take all the information we've done today along with your resume, look it over, and then I'll let you know probably in a couple days or so.
Okay.
Okay?
Thank you so much.